Excruciating pain comes in waves for Lindsay Daly-Vincent, who has endometriosis.
I've had to take days off work. I've ended up in hospital twice because of it.
For the past 2 years, she's been waiting for an initial appointment with a public gynaecologist in Sydney.
It's been insanely frustrating. The public waiting system is just, it's kind of put me on the back burner. It's like as if they've just forgotten about me.
She's not the only one feeling forgotten. In parts of South Australia, wait times for gynaecologists and gastroenterologists extend beyond 4 years. In Victoria, some people are waiting to see ear, nose and throat surgeons for more than 8 years, while in parts of Tasmania, people are waiting to see brain surgeons for more than 6 years. Some cases deemed urgent are languishing on lists for longer than 2 years, despite the recommended timeframe of 30 days.
If they're not dying whilst they're waiting, the delay may alter the outcome to be the difference between life and death. The word heartbreaking comes up after 50 years as a doctor to think that we've got to this stage.
The figures are based on the waits for a first appointment at public outpatient clinics, although some states, like New South Wales, don't publish them.
That's one issue we need to grapple with. Better understanding the demand, where demand's exceeding supply in the private health sector as well as the public health system.
Demand is so great, Western Sydney paediatrician and former State Labor MP Andrew McDonald gets text messages every day offering huge sums of money to pick up extra work. But he's so busy, he's been forced to close his books to new patients.
The 33 years I've worked in Campbelltown, it's never been as hard for a parent whose child needs to see a paediatrician.
Australia's ageing population and the increasing prevalence of chronic conditions are driving demand, but training positions for the next generation of doctors are limited.
We can predict that the shortages will get worse if nothing's done. We need to reimagine the health system and create new models of care.
We cannot keep calling Medicare a safety net with these big holes in it. These are huge rips in the basic fabric of Medicare, and the time has now come to fix it.
These wait times are the latest indicator universal healthcare is becoming anything but. As one specialist put it, the difference between private and public care should be the same as flying business or economy. The journey should still start and end at the same time. The federal government argues it's focused on boosting the health workforce, but without significant additional investment in public hospitals, it will be a long time before all Australians are travelling together. Stephanie Dalzell, ABC News, Canberra.